You have been diagnosed with prostate cancer. Your doctor has recommended you to undergo a robot-assisted radical prostatectomy, or simply RARP. A radical prostatectomy is a surgical procedure where all of your prostate is removed. This animation shows how the procedure is done. RARP is carried out under general anesthesia. During a general anesthetic, medications are used to send you to sleep, so you are unaware of the surgery. When you are fully sedated, small cuts are made in your belly. Surgical tools and a camera are inserted through these cuts. The surgical tools are attached to the arms of a robot. These arms are controlled by the surgeon with a console, which is placed next to the operating table. The surgeon detaches the prostate from the surrounding tissue. The seminal vesicles, two small fluid-filled sacs next to your prostate that secrete fluid which partly composes the semen, are also detached. Sometimes the lymph nodes, commonly known as glands, are removed also. The surgeon will take care to cause as little damage as possible to the nerves and blood vessels surrounding the prostate. The prostate and seminal vesicles are removed from the body through one of the cuts in your belly. The bladder and urethra are now sutured together. Robot-assisted surgery provides a clear visualization of even the smallest parts in your body. A catheter is inserted in your bladder to help the stitched-up wound to heal. The catheter removes urine from your body. You will be wearing it for a period after you have left the hospital. It will remain in place by inflating the balloon at its tip.
What happens in a prostatectomy is that after the prostate is taken out, the bladder is connected to the urethra, moving it down to where the prostate once was. Along the way, one of the two sphincter muscles that provides bladder control is also removed. You still have another, but that can be damaged in the process, affecting your bladder function. When you have this procedure, don't imagine that you're going to be the exception to the rule. You can almost certainly expect some leakage in the months right after. Most men regain control in a few months to a year, but for about 6 to 8% of men, the problem can persist. You might experience stress urinary incontinence, where you leak when stress is placed on your bladder or sphincter. Coughing, laughing, sneezing, or exercising are often enough to produce leaks. You can also have overflow incontinence. This happens when you can't completely empty your bladder, often caused by a blockage of the bladder due to scarring from injury. Urge incontinence, the sudden feeling that you have to urinate right now, is common as well. So what can you do to improve your chances for a speedy return to drier days? There are a number of treatment options available to you. The first thing you're going to want to do is make use of absorbent products to help manage your episodes. There are a number of great products on the market, many of which feel natural, comfortable, and are virtually unnoticeable. Next on the agenda are pelvic floor exercises. They're known as Kegels, and they can help develop your pelvic floor muscles the same way that other exercises
referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder and bowel and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around the base of the penis, as if you are trying to stop the flow of urine. You should see your penis draw in and your scrotum lift up. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice, as the pelvic floor muscle tightens, the anal passage closes. The same action happens to the urethra. By exercising the pelvic floor regularly, You will train your muscles to work automatically when they are needed.